66 positive rats. Tragically, there has been 4 deaths reported overnight. 3 were in aged care, and from the outset, once again, can I please extend my condolences to the families who've lost loved ones during this time. We've had 24,875 tests in the past 24 hours, and in good news, we are now under the 500 people in hospital. So that's still a lot of people, but it is coming down, which really means we're coming off that wave. So I really want to thank Queenslanders for the great work they've been doing there. And the Chief Health Officer will give more information. Vaccine coverage, 92.34% at least one dose, 90.28% double dose, and boosters, 61.15% of the eligible population have received their boosters. And in relation to the 5 to 11-year-olds, 40.93% of children, and 3.5 million rats have been distributed to our HHSs across the state. And I've just been advised by the Deputy Premier that another 1.5 million have come in, which is also really good news. So look, I'll hand over to the Chief Health Officer and then the Health Minister, and then we're happy to take any other questions. Thanks.
Thank you very much, Premier. So sadly, we have 4 deaths to report today, 3 people in their 80s, 1 in their 90s. 1 of these people was not vaccinated, 2 had received a single dose of vaccine, 1 had received 2 doses, and none had received boosters. And of these 4, 3 were from residential aged care facilities, and our thoughts are with their families today. Importantly, though, the data that I find most useful in terms of tracking this pandemic is the hospitalisation data, and this is really taking a very positive turn. So we have 462 people in our public hospitals being treated for COVID-19. So just 19 days ago, we were at our peak of 928 patients. So in 19 days, we have halved the number of people that are in our hospitals. So clearly we're well on track to coming to the end of this wave of infection. There were 508 people yesterday in hospital. So at present, the number of people in hospital includes 44 patients in intensive care. That's in the public hospitals, 20 of whom are ventilated. In the private hospitals, we have 34 patients with COVID, which is up slightly from 30 yesterday. The other thing we're looking at very closely are infections in children, given the schools returned on Monday. We're averaging about between 1,000 and 1,500 children diagnosed formally with COVID per day across the state, almost all of whom have very mild disease. Of those children, about half, roughly half, are in the primary school age between 5 and 11, and the other half in the secondary school age between 12 and 17. We're looking at we collect data on these children both from the collection of self-reported rats, and today we have 652 positive rat tests in children, which is down slightly from yesterday when it was 710. You might recall there was a glitch with the data collection from PCR testing yesterday. So today we report 1,113 positive PCRs in children. Yesterday it was 137, which was an underestimate. So what I can tell you is the average for the weekend is 625 positive PCRs, which is slightly up from Friday, which was 516 PCRs. So there's still no clear trend among children, but it is very early. They only returned to school on Monday. It would be a very big surprise if we don't see a significant increase in the number of cases in children in the next couple of weeks, but so far not a significant rise. I will remind you that we had substantially greater numbers of children infected 2-3 weeks ago, and we're actually at the bottom of that curve with children. So a substantial number of children will in fact be immune to COVID-19. So it's not quite clear what will happen to children in the next couple of weeks, but we do expect increasing numbers. So the basic summary is things are going far better than we had ever projected in terms of the COVID wave, this Omicron wave. So it'll be interesting to see what happens in the coming weeks. I'll now hand over to the Health Minister.
Thank you. Can I also pass on my condolences in relation to those deaths that we're reporting today, the 4 individuals. Certainly I know it doesn't matter how small that number is, it's still a loss of life, and those families, I have no doubt, are deeply grieving right now, and our thoughts go out to them. It is pleasing to see our hospitalisation numbers continue to come down, as do the number of our staff that are positive and who are close contacts needing to be out of the workforce. So that all goes well to taking pressure off our health system, but I do remind that we still are managing COVID patients in these hospitals. We still are prepared for any person who walks into an emergency department could very well have COVID, and as many of the hospitals have reported to us, patients who are coming in for other appointments, other surgeries, who are being admitted are also showing up positive as well without realising that they actually had COVID because they weren't showing symptoms for that. Can I give a huge shout out to the parents and carers and guardians of the children that are coming forward and registering their positive rapid antigen test, or those who are being taken for PCR tests. We're very grateful that they're coming forward and getting tested and then isolating as a consequence. That means that we'll have less spread in the schools because parents are doing the right thing, and as soon as those children are showing symptoms, they are testing them and they are isolating, and of course so are the household members, and that all helps with the transmission. So I do remind people that our testing clinics are still available, and if parents do not have rapid antigen tests at home or do not feel comfortable with self-administering those tests, they can take their child to one of our testing clinics to get a PCR test by one of our health professionals. But we're very pleased with what we are starting to see with these numbers, and we ask people to continue to practice all of those rules around masks, social distancing, and of course getting tested if you have any symptoms. Thanks.